India's COVID positivity rate has dropped below 10%. This is for the first time in nearly a month. The cases in the last 24 hours are now under 2 lakhs at 1,61,386. That's down by just over 3%. The deaths are up, but that's because there's been a backlog of deaths added from Kerala. The tests are also up at over 17 lakhs. The vaccinations today, as of just a short time ago, are over 52 lakhs. That's down, so that needs to be pushed. The daily positivity rate, as we said, is below 10%, so that's good news. So let's go across now to one of India's top doctors, Dr. Devi Shetty, who heads the Karnataka Covid task force and has been tracking this closely. He's also the chairman and founder of Narayan Health. Dr. Shetty, thank you for joining us. You're always calm, even when the COVID pandemic was much worse, but you're always calm and you always have a very different perspective on what's happening on COVID. What do you think we should now look at treating COVID, as we seem to have gone through now our third wave with COVID?
See, we have been observing COVID for quite some time. When we had a institutional positivity rate of about 32-35%, we had few hundred patients in the ICU in our hospital in Bangalore. Now our positivity is reaching over 50%. And we have only about 23-24 patients in our ICU. And we see large number of patients getting tested, especially our colleagues, without any symptoms or mild symptoms. We know COVID is there and the number will be high for quite some time. The question is whether it is life-threatening or whether it is going to make them very, very sick for at least a few days. That is not the picture. The COVID, what we saw, second wave and the COVID now are dramatically different. So my suggestion is we have 2 years of no school, no work, hardly anybody coming out of. I can understand, I'm a doctor. The last thing I want is to put anyone's life at risk. But our observation is that across the country, ICUs are not getting filled. There are a lot of empty beds, and I talk to all my colleagues. All of them are saying that there is no point in doing this many tests and creating the panic situation. We have to do the test like dengue, malaria, TB, whatever. Somebody is having a symptom, we do the test. Somebody comes to the doctor, we do that. Not randomly going across and doing the test.
But Dr. Shetty, there's been so much conflicting advice on this. The World Health Organization has warned that you can't dismiss Omicron or the latest variant as mild. It's very misleading. We now have a new variant which is emerging, BA2. So aren't you worried when you say, for instance, that don't take this so seriously, don't test randomly? What about for vulnerable groups, like a child maybe catching it and giving it to an elderly grandparent, or any other person who is, say, suffering from cancer or has compromised immunity?
In our experience of observing thousands of Omicron patients, right now the way it is not that dangerous. Even for elderly people, we have noticed it is not that dangerous. But vulnerable people have to protect themselves. We have to practice social distancing. We have to do everything. All I am trying to say is that current virus, what is going around in India, is dramatically different than the second wave Delta version. I don't know 6 months later what the virus will be. 6 months later, if you are going to have a very serious COVID wave, what is the point in closing the institutions and paralyzing the country? See, we read the newspaper every day that this many people are tested positive, but we don't get the information as how many people are in the ICU. That is what is important. Let the whole country be positive, doesn't matter. But are they overwhelming the health system? If they are not, we shouldn't be very active in testing more and more people.
So, Dr. Shetty, because we've also been looked at this whole process on booster doses, and there was some controversy that, healthcare workers and the elderly should have got it much earlier. But now there's still no clarity on whether booster doses are needed, whether they're going to be extended to the whole population, the whole adult population, because in the West they're giving booster doses, but in India there's still some confusion on this. What would you think on whether we need booster doses?
See, the COVID vaccination will become an annual event, because like a flu shot, the RNA vaccines do not give you lifelong protection. So we need to have a vaccination protocol. Every year we have to vaccinate at least for a few more years. About the booster shot, there is still different views. I am not an expert in this area, so I don't want to talk about my opinion. Yeah.
Right, but Dr. Shetty, also what we're seeing now, and especially in private hospitals, is that if you get COVID, that often now being prescribed is monoclonal antibodies. And there's this whole concern about the whole range of medicines that are being prescribed, different kinds of antibiotics, and now there's warning that don't use steroids. But now many people, doctors are prescribing monoclonal antibodies and various medications. Do you agree with that? Should a patient who gets COVID be taking monoclonal antibodies?
See, there are hundreds of pharmaceutical interventions have been suggested against COVID, but there is only one treatment, one pharmacological intervention which made a massive difference, that is vaccination. A good number of people received first vaccination, but they didn't take the second vaccine. They have to go and protect themselves with the vaccine. And everything else, I leave it to the doctors to decide. I don't want to express my opinion. It will be a bit controversial, but we should follow the international norm. The best country to understand what is the best treatment is England, because it's a national health service, and if they accept certain type of treatment protocol, I think generally we should accept. But on the whole, our policymakers have been very responsible in giving the right suggestion. But whether it is implemented in every part of the country, it is a bit difficult. We are a truly democratic country. Everyone has their own views.
No, but so Dr. Shetty, what is your controversial view on the medication that you need for COVID? Because I think people would like to hear your view, because you've always focused on keeping public health a priority and keeping costs down at hospitals.
I tell you, 4 of my children got infected. My daughter-in-laws got infected. All my grandchildren got infected, but none of them were given any of the fancy drugs. They were given painkillers for the fever for 2-3 days, and they were fine. That's all I can say.
Well, that's wonderful to hear, Dr. Shetty, and I'm sure all our viewers will look at that advice and, of course, consult their own doctors as well. But thank you so much, Dr. Shetty, for your views on the 8 o'clock news tonight.